Treatments have to be canceled or postponed, like for people who are waiting for cancer surgery. We're not out of the woods yet with this virus. Everyone is working around the clock to get as many Canadians vaccinated as quickly as possible. But right now, more contagious and dangerous variants are spreading and threatening the progress we've made. Even with millions of Canadians already having received their first dose, we need to keep doing what we know works to stop the spread of the virus. So avoid gatherings, stay home when you can, wear a mask, keep your distance, and download and use the COVID Alert app. We know what it takes to stop this wave. We know how to get out of it. We've done it before. We just need to hang in there, be careful, and protect our loved ones, protect our essential workers, do the right thing so we can get to a summer that is better than right now. Today, I also want to address teachers, parents, and kids across the country. Yesterday, Premier Ford announced that schools will close in-person learning indefinitely as cases of COVID-19 rise sharply in Ontario. And we know that other provinces are watching the situation in their schools, too. I know this isn't easy. So to teachers, parents, and kids, thank you for your efforts once again. You are stepping up in incredible ways, and I know it's tough. Nobody wants to go back to online learning. Nobody wants to be stuck at home. But we have to make it through this, and things will get better because of what we're all doing right now. Since the beginning of the crisis, we've invested $2 billion through the Safe Return to Class Fund to help provinces and territories make your schools safer. And we will continue to do whatever it takes for as long as it takes to get us through this. Jusqu'à maintenant, on a livré plus de 11,3 millions de doses de vaccins contre
doses of COVID-19 vaccine have been delivered to the provinces and territories.
Pfizer, cette semaine, comme
Pfizer,
prévu, on a reçu
as
un peu
planned,
plus
has
d'1
received,
million de doses.
we've received just
Pour ce
over
qui est
1
de
million
Moderna,
doses of the
une
Pfizer.
livraison
As for
de
Moderna, a
850
shipment
000
of
doses a atterri au
850,000
Canada
doses
ce
arrived
matin.
in Canada this
La
morning.
vaccination progresse.
Vaccination
Chaque
is
jour,
progressing.
il y en a
Every
plus en
day,
plus, il y a plus en plus de gens qui reçoivent
more and more
leur
people
dose.
are
Mais
receiving
ça
their
n'empêche pas
doses,
qu'il
but
faut
that doesn't
continuer
mean
de se
we can't
protéger les
continue
uns
to
les autres
protect each other
en
by
suivant les
following
conseils de la santé
public health
publique.
advice.
Avec ces variants, les
With these
cas
variants,
durant cette troisième
the
vague se
cases in this
propagent
third
très
wave are
rapidement.
spreading very quickly.
On est tous tannés
We're
de
all
la
tired
COVID-19.
of
Avec
COVID-19.
les événements des dernières
With the
nuits à
events
Montréal
of the
et
last few
ailleurs
nights
dans
in
le pays,
Montreal and
on
elsewhere
voit qu'il y a
in the
des
country,
gens
we
qui
can
sont de
see
plus en plus frustrés.
that there
Mais
are
quand
people
on
who
ne
are
respecte pas les
increasingly
consignes de la santé
frustrated, but
publique, on
so
ne
long
fait
as we
que
are not following
prolonger
public
la
health
situation.
advice, we're only
Et on veut sortir de
prolonging
cette
the
troisième vague. Tout le
situation,
monde
and we
veut
want
sortir de cette
to get out of
troisième
this
vague
third
le
wave.
plus
Everyone
rapidement
wants
possible.
to exit the third wave
On
as
doit
soon as
continuer nos
possible.
efforts pour
We
sauver des
need
vies,
to
pour aider
continue our
nos
efforts
travailleurs de
to
santé qui
save
sont
lives,
débordés.
to help our healthcare workers who are overwhelmed.
Encore quelques semaines
Just a few more
de se
weeks,
retenir, de suivre les instructions de
more
santé publique,
weeks
de
of
faire très
following the public
attention.
health advice,
Et on peut avoir de
guidelines,
l'espoir
being very
d'avoir un
careful,
été
and then we
beaucoup
can have a
meilleur.
hope for a
Et comme vous
much better
savez, les cas
summer.
qu'on
But
a
as you know, the
aujourd'hui,
cases we're dealing with today
c'est basé sur
are
les
based
actions qu'on a prises il y a une
on the
semaine, il y a 2
actions
semaines.
we took a week or
Et
2 weeks ago.
si on veut que dans 2
And
semaines,
if we want
on puisse voir les cas baisser,
to see a
il
decrease,
faut
a
faire les
drop in the
bonnes
number of
choses
cases,
aujourd'hui.
so in 2 weeks, we need to do the right
Les
thing
vaccins
today.
arrivent, mais il faut
Vaccines
réduire
are
les cas
coming,
aussi.
but we need to reduce cases.
D'ici la fin de juin, on va
By the
avoir
end of June,
44 millions
we
de
will
doses
have
de vaccins.
received 44
Alors, c'est
million
surtout pas le
doses
moment de
of
lâcher,
vaccines. This is
aplatir
not
la
the
courbe.
time to give up.
Depuis le début de la
Flattening the
crise, on
curve.
parle souvent des travailleurs
Since the
essentiels.
beginning of the
Que ce
crisis,
soit dans
we've
nos
often talked
hôpitaux,
about
dans nos
essential
écoles ou
workers,
ailleurs,
whether in our
ces
hospitals,
travailleurs
schools, or
font des
elsewhere, as we
efforts
said earlier.
incroyables.
These workers are
Et
making
quand on
incredible
parle de
efforts.
travail essentiel,
And
ça
when we talk
inclut
about
bien
essential
sûr
work,
le
well,
travail
that of
crucial
course
de nos
also
agriculteurs
includes the
qui nous
crucial work
permettent
of
de
our
mettre la
farmers who
nourriture
allow
de
us to
qualité
put
sur
quality
nos tables.
food on our tables.
Une des choses que la pandémie nous a démontré,
One
c'est
of
à
the
quel
things that
point
the
il est
pandemic
important
has
d'avoir
shown
un secteur
is how
agricole
important it is to have
fort
a
et
strong
résilient.
and resilient
Et comme
agricultural
qu'on
sector.
continue de travailler sur la relance
As we
économique,
continue to
on
work
veut
on
s'assurer que
economic
les
recovery,
producteurs
we
canadiens
want to
sous
ensure
gestion de
that
l'offre
Canada's
aient les outils
supply-managed
nécessaires pour
producers
réussir.
have the tools they need to
There are
succeed.
thousands of poultry and egg farms in Canada. A lot of them are owned by families. Last year, we promised those families that we would invest over $690 million over 10 years to provide full and fair compensation to Canada's chicken, turkey, and egg farmers following the CPTPP trade agreement. Later today, Minister Bibeau will share details about how this funding will help producers invest to modernize their farms and how it will help promote Canadian-made products here at home. But the bottom line is this: our government will always be there for Canadian farmers. So to farmers, thank you for your incredibly hard work. You stepped up during this pandemic to get good food on our plates. Through this pandemic and beyond, we've got your back. Together, we'll continue to build a sustainable future for rural farm families and for all the Canadians who rely on you every single day. Anyone who's seen the endless miles of wheat and canola as they drive across the country can tell you just how big Canada is. In a country like ours, air travel is an essential service. On that front, yesterday, Deputy Prime Minister Freeland and Minister Alghabra announced that we've reached an agreement with Air Canada to secure air travel for Canadians for the future. The conditions for Air Canada to receive this support are very clear. They will ensure that regional communities have air connections to the rest of Canada. They will refund their customers for pandemic-related cancellations. They will commit to protect jobs, pensions, and collective agreements. And they will restrict executive compensation, buy back shares, and dividends. Air Canada will also have to demonstrate how they will support environmental sustainability and national climate goals. The deal is a good and fair deal in the interests of jobs, workers, communities, and customers. L'entente annoncée hier avec Air Canada va
Yesterday's
protéger
agreement
les
with Air
emplois,
Canada will
garder nos
protect
communautés
jobs,
connectées
keep our
et
communities
assurer que les
connected,
passagers
and
soient
ensure
remboursés.
that passengers are
Le secteur
refunded.
aérien est un secteur
The airline
stratégique
industry
pour
is a
notre économie
strategic
et
sector
nos
for our economy,
négociations avec les autres
and our
transporteurs
negotiations with
aériens
other
se
airlines
poursuivent.
are ongoing.
Comme toujours, on va s'assurer
As
de mettre les
always, we will
intérêts des
ensure
Canadiens
that the
et des
interests of
travailleurs
Canadians
au
and
cœur
workers
de tout ce qu'on
are
fait.
at the heart of everything we do.
This past year has been tough. There have been a lot of special moments and celebrations that have been done differently. Yesterday, I had the chance to speak virtually with Sikh healthcare professionals from across Canada to celebrate Vaisakhi and Sikh Heritage Month and to thank them for everything they do. Happy Vaisakhi to everyone celebrating. This week also marks the start of Ramadan. I want to take this opportunity to thank the many Muslim Canadians who continue to work hard on the front lines and the many others who are helping their neighbors and communities during these difficult times. Cette année encore, le Ramadan
This year,
va être bien
Ramadan
différent.
will be
Il
different
faudra
again.
se servir des moyens
It
virtuels
will
pour se
involve
réunir
virtual
en ligne
means
plutôt
of
qu'en
gathering
personne.
online rather than
Mais
in
une chose
person.
est certaine,
But one
la
thing is for
pandémie ne
sure,
nous
the
empêchera pas de
pandemic
célébrer les
will
valeurs
not
de
stop us from
gratitude, de
celebrating the
compassion
values
et de
of gratitude,
générosité
compassion, and
qui sont au
generosity
cœur des
that
communautés
are at the
musulmanes
heart of
et qui
Muslim
sont
communities
partagées par des
and that are
Canadiens
shared by
de
Canadians
tous les horizons.
from all walks of life.
Ramadan Mubarak,
Ramadan Mubarak.
merci. Je suis maintenant content de céder la parole à
I will
la
now
Dr.
turn the
Tam
floor over
and
to
to say
Dr. Tam.
congratulations, Teresa. I think you just received your vaccine as well. That's good news.
Bonjour à toutes et à tous. As we continue to track current surveillance data against the longer-range modeling forecast from just over 2 weeks ago, we are seeing daily cases still rising along a strong resurgence trajectory. Although COVID-19 vaccine benefits are being seen for high-risk groups prioritized during the initial rollout, experience worldwide is unequivocal in cautioning us that strict public health measures will continue to be crucial during this phase of vaccine rollout, especially in the presence of high rates of disease. To date, over 1,071,000 cases of COVID-19, including over 23,350 deaths, have been reported in Canada. Over the past week, there has been a 33% rise in daily case counts, with an average of almost 8,100 new cases reported daily. During the same time, the number of people experiencing severe and critical illness continues to rise. On average, over 3,000 people with COVID-19 were being treated in our hospitals each day, representing a 29% increase over last week. This includes almost 970 people being treated in intensive care units, which is a 24% higher than last week. Although the number of deaths has averaged around 30 each day for several weeks, there is concern that if the increase in severe illnesses persists, we could see a gradual increase in the mortality trend. With today's average at 34 deaths daily over the past week, today's average at 34 deaths daily over the past week. There are almost 36,000 variants of concern cases reporting to date across Canada, with the B117 variant accounting for over 96% of these. These trends are discouraging, but they reinforce why we must strengthen precautions to bring this variant of concern-driven resurgence under control quickly. This is a third big push, and we're all tired, but the benefits of applying our strongest collective effort by following public health advice and strictly maintaining individual precautions could not be greater. This push will enable us to focus more capacity towards vaccine rollout. Two great examples of this unified effort I will highlight today are from Nova Scotia. We have recently learned of a vaccine clinic organized for Black Nova Scotians in the Hammonds Plains community, just outside of Halifax. The clinic was held at the historic Emmanuel Baptist Church, which has long been an important fixture in the community. Coming together in solidarity to receive COVID-19 vaccines is a testimony to the community's perseverance and commitment to ensuring people feel culturally safe in the vaccination process. I also heard about a pharmacist in Cape Breton who converted an old ambulance into a mobile clinic to bring COVID-19 vaccination to seniors and people with mobility challenges. There are so many examples from individuals to organizations finding ways to help others and make sure that we all end this crisis together, stronger and more united. Finally, on our current trajectory, it might seem premature to think of the days when restrictions will ease and social and economic activities will resume. But if we want to take forward the things we've learned about the importance of family, community, and equity, about how we supported each other, adapted, and innovated, we must commit to acting thoughtfully, clear in the view of what we want to take forward. The end of this crisis will be a time of great change. Let's not race towards the finish and risk stumbling along the way. Let's make every step count by continuing at pace together. Thank you.
Bonjour à toutes et à tous. Alors que nous continuons d'assurer le suivi des données de surveillance actuelles par rapport aux prévisions modélisées à long terme établies, il y a un peu plus de 2 semaines, nous constatons que le nombre quotidien de cas augmente toujours selon une trajectoire liée à une forte recrudescence. Bien que nous remarquons les avantages de la vaccination contre la COVID-19 chez les groupes à risque élevé vaccinés en priorité lors de la campagne initiale, ceux qui passent partout dans le monde nous mettent en garde sans équivoque quant à la nécessité de maintenir des mesures de santé publique rigoureuses pendant la présente campagne de vaccination, particulièrement en présence de taux élevés de maladie. À ce jour, plus de 1 million 71 000 cas de COVID-19, dont plus de 23 350 décès ont été recensés au Canada. Au cours de la dernière semaine, le nombre quotidien de nouveaux cas a augmenté de 33%, en moyenne presque 8 100 nouveaux cas étant signalés chaque jour. Au cours de la même période, le nombre de cas graves et critiques de la maladie continue d'augmenter. En moyenne, près de 3 000 personnes atteintes de la COVID-19 ont été
On
traités dans
average,
nos hôpitaux
over
chaque jour,
3,000 people with
soit une
COVID-19 were
augmentation de
being treated in our
29%
hospitals each
par
day,
rapport à la semaine
representing a
dernière.
29%
Ce chiffre
increase
comprend
over
presque
last week.
970
This
personnes
includes
qui étaient
almost
dans des unités de
970
soins
people being
intensifs,
treated
ce
in
qui
intensive care
représente une
units, which
augmentation
is
d'environ 24% par
24%
rapport à la
higher
semaine
than
dernière.
last week.
Bien que le nombre de décès s'élève en moyenne
Although the
à
number of
environ
deaths
30
has
par jour
averaged around
depuis
30 each
plusieurs
day
semaines,
for
nous
several
craignons
weeks,
que si le
there is a
nombre de cas
concern
graves continue
that if the
d'augmenter,
increase in
cela
severe
pourrait se
illnesses
traduire
persists,
par une
we could see a
augmentation
gradual
graduelle du
increase
taux de
in the
mortalité.
mortality trend.
Nous avons enregistré une moyenne de 34 décès par jour au cours de la
To
dernière
today's
semaine.
average
Il y a
at
presque
34
36 000 cas de
deaths
variants
daily over the past
préoccupants
week.
signalés à ce jour au
There
Canada.
are almost
Le variant
36,000 variants of
B117
concern
représentant
cases
plus de
reported to date across
96%
Canada,
des
with
cas.
the
Ces
B117
tendances
variant
sont
accounting
source de
for over
découragement, mais
96% of
elles
these.
démontrent pourquoi nous
These
devons
trends are
prendre des mesures
discouraging,
de précaution
but they
encore
reinforce
plus
why we
rigoureuses
must
afin de
strengthen
maîtriser
precautions to
rapidement
bring this
cette
variant of
recrudescence
concern-driven
liée aux variants
resurgence
préoccupants. C'est
under
notre
control
troisième série
quickly.
d'efforts importants et nous
This
sommes
is the
tous
third big push,
fatigués, mais les
and we're all
bénéfices que
tired,
nous
but the
obtiendrons
benefits of
en nous serrant les
applying
coudes comme
our
jamais auparavant,
strongest
en
collective effort
respectant le Conseil de santé
by
publique
following
et en
public health
appliquant
advice and
rigoureusement
strictly
les précautions
maintaining
individuelles
individual
seront les
precautions
plus
could
importants
not be
à ce
greater.
jour. Les efforts que nous déploierons
This
nous
push
permettront
will
d'affecter
enable us
davantage de ressources à la
to
campagne de
focus more
vaccination.
capacity towards
Les deux
vaccine rollout.
exemples de solidarité que nous mentionnerons aujourd'hui
Two
ont
great
eu lieu en
examples of this
Nouvelle-Écosse.
unified effort
Nous
I
avons
will
appris
highlight today
récemment
are
qu'une
from Nova
clinique de
Scotia.
vaccination
We
a
have
été
recently learned of
organisée
a
à
vaccine clinic
l'intention de la communauté noire
organized for
néo-écossaise à
Black Nova
Hammonds Plains,
Scotians in the
en
Hammonds
périphérie de
Plains community
Halifax.
just
La
outside of
clinique s'est
Halifax.
déroulée dans
The
l'église
clinic
baptiste
was
historique
held at the
Emmanuel,
historic
qui fait
Emmanuel
partie
Baptist
intégrante
Church,
de la
which has
communauté
long
depuis
been an important
longtemps.
fixture in the
Ce geste de
community.
solidarité dans le cadre
Coming
de la
together in
vaccination
solidarity
contre
to
la
receive
COVID-19
COVID-19
témoigne de
vaccines
la
is a
persévérance et de
testimony
l'engagement
to
de
the
la
community's
communauté en
perseverance and
permettant
commitment
aux personnes de
to
recevoir le
ensuring people
vaccin
feel
dans le
culturally
respect
safe
de leur culture.
in the vaccination
Nous avons
process.
également été informés qu'un
I also
pharmacien de
heard about a
Cap-Breton
pharmacist in
a
Cape Breton
converti une
who
ancienne
converted an old
ambulance en clinique
ambulance
mobile
into a
pour
mobile
permettre
clinic
aux aînés et aux personnes à
to bring
mobilité réduite de se faire vacciner
COVID-19
contre la
vaccination to seniors
COVID-19.
and
Les
people with
exemples sont si
mobility
nombreux de
challenges.
gens et
There are so many
d'organisations
examples,
qui
from
innovent pour
individuals to
aider les autres à
organizations,
veiller à
finding
ce que nous
ways to help others
sortions de cette
and
crise
make sure
ensemble,
that we all
plus
end this
forts
crisis
et plus
together,
unis.
stronger and more
Finalement,
united.
compte tenu de la trajectoire
Finally,
actuelle de la courbe,
on our
il
current
pourrait être
trajectory, it
prématuré
might
de
seem
songer
premature
au
to
moment
think of the
où les
days when
restrictions seront
restrictions will
allégées
ease
et où les
and
activités
social and economic
économiques et
activities
sociales
will
reprendront.
resume.
Cependant, si nous
But
voulons
if we
mettre à
want to
profit
take
ce que
forward
nous avons
the
appris sur
things we've
l'importance de la
learned
famille,
about the
de la
importance of
communauté et
family,
de
community,
l'équité, sur
and
comment nous
equity,
avons pris soin les
about
uns
how
des
we
autres,
supported each other,
nous nous sommes adaptés et avons
adapted and
innové, nous devons
innovated,
nous engager
we
à agir
must
de
commit
façon
to
réfléchie,
acting thoughtfully,
en sachant clairement quelles leçons nous
clear in the view
désirons
of
en
what we
tirer.
want to take forward.
Cette crise laissera
The end
place
of
à
this
une période de
crisis
changement
will be a
important.
time of great
Ne nous
change.
hâtons pas trop vite,
Let's not
car nous
race
risquerions
toward
de
the finish
rencontrer des
and risk
obstacles.
stumbling along the
Passons
way.
chaque étape
Let's
une
make
à la
every
fois
step
en
count
continuant de
by
faire des choses
continuing
tous en
at
même temps.
pace together.
Merci.
Thank you.
Thank you, Dr. New. The PM will be answering questions for 20 minutes. Minister LeBlanc, doctors will remain available for more questions for another 15 minutes afterwards. One question, one follow-up, starting with the phone. Merci beaucoup, Dr. New. Le premier ministre va répondre aux questions pendant 20 minutes et doit nous quitter par la suite. Le ministre Leblanc et les docteurs répondront à d'autres questions par la suite pour un total de 15 minutes. Une question, une sous-question, en commençant par le téléphone. Opérateur, c'est à vous.
Merci. Thank you. Please press star one if you have a question. Veuillez appuyer sur étoile 1 pour poser une question. Notre première question est de l'inaudible de la presse canadienne. À vous la parole. Please go ahead.
Oui, bonjour.
Hello.
J'aimerais savoir si les derniers développements sur le vaccin de Johnson & Johnson changent quelque chose à notre intention de commander les 10 millions de doses.
Any
Ça
effect
retarde le
on
contrat
our
ou
intent
est-ce qu'on
to
attend encore les premières doses
still
fin avril?
receive those doses that we are expecting or would we
Merci,
postpone?
Lina. On est dû pour recevoir nos premières
Answer.
doses de
We're
Johnson
expecting
Johnson
to receive
à
our
la
first
fin
doses of
du mois
Johnson
d'avril.
and
Mais
Johnson by the end of
évidemment,
April, but
on
of
va
course,
continuer
we
de
will
regarder
continue
attentivement
to
ce qui se passe aux
closely
États-Unis
monitor what's
avec
happening in
leur
the US
expérience.
with their
On
experience.
continue d'être en discussion
We are
avec la
still
compagnie
having
et
discussions
de
with
comparer
the company,
nos données
ongoing
avec
discussions,
tous nos
and
partenaires.
we're comparing
Mais
our data
Santé
with all of our
Canada va
partners. But
toujours
Health
prendre
Canada
les bonnes
will
décisions
always make the right
pour assurer la
decisions to
sécurité
ensure
de tout le
the
monde.
safety
Et
of everyone.
c'est aussi un exemple de pourquoi c'est
This
une
is
bonne
also
chose
an
qu'on ait
example of why it's a good
tellement
thing that
de
we
différents
have
contrats avec
such a
différentes compagnies de
variety
vaccins,
of contracts
parce
with
que
so many
même
different contracts with
sans
such a variety
Johnson
of
Johnson,
companies.
on va
Even without the
avoir
Johnson &
plus de
Johnson vaccine, we'll
44
have more
millions
than
de
44
doses
million
d'ici
doses
la fin
by
du
the
mois de
end
juin.
of June.
C'est important d'avoir
It's
plusieurs
important
options et
to
c'est
have some
exactement
options,
ce qu'on
and
a.
that's exactly what we have.
Donc, si je comprends bien...
Juste une seconde, Lina, je vais répondre en anglais d'abord.
I'll answer that in English now.
We are still on track to receiving our first shipment of the Johnson & Johnson Janssen vaccine by the end of this month. But obviously, we're following closely developments in the United States, and we can assure everyone that Health Canada will, every step of the way, put the health of Canadians first and foremost in any decisions we make around distributing vaccines. But it also goes to highlight that it was important that we signed deals with a large range of potential vaccine makers because we didn't know which ones would be most effective, which ones would arrive early. That's why Canadians are well served, and even without the Johnson & Johnson vaccine, we are going to be receiving over 44 million doses by the end of June.
En suivi, Lina?
A follow-up, Lina? Thank you.
Donc, dommage que Mme Anand ne soit pas là, mais si je comprends bien,
Minister Anand is not
on ne
here,
touchera
but
pas
from what I
au
gather,
contrat, ça ne changera
we
rien. On va
we
quand
won't
même
change the
acheter
contract.
des millions de doses
We will still be
et
purchasing those
décider
millions of
entre-temps
doses
si on
of
les
Johnson &
administre ou
Johnson,
pas, si
and
jamais
then
il y a un problème.
deciding after the
C'est ça
fact
qu'on
whether or
fait
not they will be administered.
On a signé des
if there's a problem.
contrats avec 7
Answer.
différentes
We've signed
compagnies
contracts with
à travers
7
le monde
companies throughout the
l'année
world.
passée
That's something
pour
we did last
justement
year,
s'assurer
precisely
que,
to make sure
quelles que soient les compagnies
that
qui
regardless of the
livraient
company
le meilleur
actually
vaccin
delivering
ou
the
un vaccin
best
efficace
vaccine or an
rapidement,
effective
nous
vaccine
allions
quickly,
être bien
we would be
positionnés.
in a good
Donc
position.
oui, on a un contrat,
Either way,
on
so
a
yes,
acheté
we
des
have a
doses
contract, we
de
have
Johnson &
purchased
Johnson et
doses
on
from
espère
Johnson &
que
Johnson,
ça va
and
être
we
des doses
hope
qu'on pourra
these
utiliser
will be
pour
doses we
protéger
can
les
use to
Canadiens de la
protect
COVID, mais
Canadians
on va
from
prendre nos décisions
COVID-19, but we will be
basées
making those
sur une
decisions
recommandation de
based
Santé
on
Canada,
recommendations from Health
basées
Canada,
sur ce que eux ils
based
concluent
on what
par
they
rapport à ce qu'ils voient dans le monde.
will conclude on the basis of what they're
Merci.
seeing the world
Opératrice,
over.
prochaine question.
Merci. Our next question is from Ryan Tumulty from the National Post. Please go ahead. À vous la parole.
Yeah, good morning, sir. I'm wondering, obviously with the benefit of hindsight, but, we're in the middle of this third wave now, and vaccines wouldn't solve it, but they certainly do some way to help address its impact. Is there anything about our vaccine procurement approach as a country that you, in retrospect, now think was a mistake, or where you would have liked to have acted earlier?
No, not in terms of our vaccine rollout. Obviously, we worked extremely hard from last summer onwards to sign many different contracts with different potential vaccine makers around the world. And we were among the first countries to start getting approved vaccines into arms back in December. We've seen various vaccine companies challenged with development or manufacturing issues. But in general, the vaccines have been arriving in Canada in steadily increasing numbers. And I think it's important to remember that vaccination alone, even being well advanced in vaccinations, doesn't necessarily lead to an ability to ease public restrictions. Just look at the case of the UK, where they obviously have a higher rate of vaccination than we have, but they also have significant restrictions and have kept them in place for quite a long time. What we need in order to ease restrictions in this country as we get closer to the summer is both for more people to get vaccinated and for the caseloads to go down across the country. Those are the two things we need to make sure happens. And restricting caseloads or reducing caseloads has to do with following public health advice, restricting our movement, limiting gatherings, wearing a mask, washing your hands, doing all those things that we know will reduce the number of cases around the country, because we've succeeded in doing it before in the second wave and way back in the first wave as well.
Following up, Ryan?
Yeah, sir. The third wave that we're seeing now is worse than it has been at any point during the pandemic for some parts of the country. I'm wondering if now, especially as these cases continue to rise, if you're considering any tighter restrictions from the federal level, either restrictions between travel at provinces or maybe more restrictions on incoming travel from overseas.
On incoming travel from overseas, we already have some of the strongest restrictions in the world and have had those in place since last March for well over a year now. The 2-week mandatory quarantine on essential travelers, the limits on non-essential travel, now the testing, the pre-boarding testing, the on-arrival testing, the mandatory quarantine while we're waiting for the results of the tests, and the 2-week quarantine in a safe situation at home are all things that have meant extremely limited importation of the virus from overseas. Unfortunately, we're still getting a lot of transmission inside the country, and that is something that we need to continue to monitor. But that's not something that the federal government needs to step up on. The extraordinarily successful example of the Atlantic bubble, for example, was done without the federal government dictating to the Atlantic provinces that they needed to do this. They made that decision on their own, and it was the right one. And of course, as a federal government, we supported them. Similar things for the Northern Territories. We are there to support the provinces as they make difficult decisions on restrictions. And part of why we're making those decisions easier is by providing unprecedented supports for small businesses, for workers, for families, for seniors, for young people, to make sure that people can stay home and stay safe, if it's at all possible, to keep those essential workers safer.
Merci. Opératrice, une dernière question au téléphone, s'il vous plaît.
Thank you. Notre prochaine question est de Marie Vastel du Devoir. À vous la parole.
Last question, Marie Vastel du Devoir. Over the phone.
Oui, bonjour. En fait, j'avais une question sur
le
vaccin Johnson & Johnson et l'utilisation qui a été suspendue aux États-Unis, mais comme M. Trudeau l'avait déjà répondu, je vais me permettre de poser ma question à Dr. Tam pour avoir peut-être une réponse plus précise.
To get some specifics from Dr. Tam on this one.
Plus précis, à savoir, est-ce que cette décision des autorités américaines
did the American authorities decision,
se répéter au Canada? Vous dites que
or rather, is that something that Health Canada could do? Is Health Canada considering suspending or stopping the use of the Johnson & Johnson vaccine? And could that mean that it would delay our own use of this vaccine? And we, I think, are expecting doses within 2 weeks.
C'est Dr. New. Peut-être moi je peux commencer.
This is Dr. New. Perhaps I can start, and then Dr. Tam may have something to add to it. Yes, we know that our colleagues at Health Canada are independent. They are closely monitoring the situation, and they're having good conversations with their counterparts in the United States. And they will be analyzing the data. They will be making a decision as to what matters in the Canadian context. So they're currently working on this, and it's not up to us at the Canada Public Health Agency to comment on the work of Health Canada.
Dr. Tam, oui.
This is Dr. Tam.
Comme vous avez déjà vu,
as you've seen,
Santé Canada a un processus très rigoureux.
A very rigorous process.
Il va suivre, je pense que à peu près le même processus.
That it follows, and it will follow the same process. The sound is cutting out.
You can go in
English if you want, Dr. Tam. I'm sorry I asked it in French, but you can go in English.
Thank you. It's okay. So I think you have seen the process once already. that the regulator in Health Canada follows when there is a signal of an adverse effect following immunization with the AstraZeneca vaccine. So I expect them to do the same due diligence connecting to the international regulatory authorities like the Food and Drug Administration in the United States and gather information from them as well as the manufacturer. We've heard about rare side effects. I think it's 6 cases of these unusual blood clots with low platelets following 6.8 million doses administered in the United States. Health Canada, we need all of this data and do, in the Canadian context, the benefit and risk analysis. Following that, I expect that the National Advisory Committee on Immunization, as appropriate, will look at that information as it supports the provinces and territories in providing guidance. And I would also expect to convene and support a discussion amongst provinces and territories as to how best use the Janssen vaccine in the Canadian context. So all those steps I expect will be followed similar to the AstraZeneca vaccine.
En suivi, Marie?
Thank you. Just a quick follow-up, Dr. Tam. When do you expect Health Canada to have done this analysis and come out with an opinion on this? Et Monsieur Trudeau, en sous-question, on voit que la France suspend tous ses vols avec le Brésil parce que la pandémie est essentiellement hors de contrôle. Je sais que les Canadiens ne devraient pas voyager, que c'est pas le temps de voyager. Donc, je vous évite de me répéter ça en réponse à ma question. Je voudrais savoir, est-ce que vous comptez au Canada demander la fin des vols
intend to ask for a stoppage of any flights to Brazil for Canada, and are you considering doing the same thing with other countries?
D'abord, on est en train de regarder très attentivement ce qui se passe à l'international et on va prendre des décisions au fur et à mesure qu'il y a plus d'informations qui rentrent. On a déjà restreint énormément de vols à l'international et on a des mesures extrêmement rigoureuses aux frontières pour assurer qu'il n'y a pas d'importation du virus de nulle part. Parce que la variante du Brésil ne se trouve pas seulement au Brésil, il y a même quelques cas au Canada déjà. Alors, tout ce qu'on est en train de faire est effectivement pour limiter la transmission. Alors, non seulement ce n'est pas le moment de voyager à l'international, ce n'est pas vraiment un moment pour voyager à l'intérieur de notre pays non plus. Donc, faites attention pendant encore plusieurs semaines et on va continuer de suivre la situation.
Merci, on va maintenant passer à les questions dans la salle.
Now, questions in the room.
That's available. I'm wondering what you say to Canadians who are at a higher risk of blood clots or who have other complications that may prevent them from getting vaccinated. Is that still the right messaging around vaccine hesitancy when many Canadians have legitimate questions about in the face of conflicting information?
Medical professionals, whether it's your family doctor, whether it's your pharmacist, whether it's the National Guidelines Committee, NACI, are making recommendations around which vaccines are right for which people. That means that gets translated into whichever vaccine you are offered is going to be the right one for you.
J'aimerais vous entendre sur la situation à l'Université Laurentienne. On a vu hier que les programmes en français sont particulièrement affectés. Question spécifique. D'abord, qu'est-ce que vous en avez pensé? Mais est-ce que vous êtes prêt à prendre le téléphone, faire pression? Et êtes-vous prêt à offrir aux besoins une aide financière pour que les programmes soient rétablis?
D'abord, nous sommes très préoccupés par la situation à l'Université Laurentienne. La communauté francophone en Ontario est justement a raison d'être très fier de ces institutions d'éducation postsecondaire francophone dans la province. Et nous allons regarder attentivement ce qui se passe. Je peux vous assurer que la ministre Joly est en contact avec son homologue dans le gouvernement de l'Ontario pour voir c'est quoi leur plan pour protéger cette institution importante. Et oui, le gouvernement fédéral sera là pour aider, mais c'est au provincial
but it's up to the province to establish the process. We will be there as we've been there with respect to the Francophone University in Ontario a few years ago. We'll be there.
Obviously, I'm very concerned with what has happened, the reports of what is going on at Laurentian University. Our Francophone institutions, particularly for minority communities like Franco-Ontarians, are extremely important that we protect. I can assure you that Minister Joly, the Minister of Official Languages, has reached out to her counterpart in the Ford government, in the Ontario government, to see what their plan is to support and protect this institution. The federal government will be there to support, but it is a provincial jurisdiction, and therefore they need to figure out what the plan is, and we will be there to support because we know how important it is to protect official language minorities across the country.
J'aimerais vous entendre sur le Grand Prix de F1 à Montréal. Je voudrais avoir vos impressions sur la tenue de l'événement comme tel, mais aussi les promoteurs demandent aux différents paliers de gouvernement 6 millions de dollars en contribution parce que, bon, les spectateurs sont pas là, etc. Est-ce que vous avez de l'ouverture à les aider? L'industrie touristique, notamment, a subi des durs coups. Alors, j'aimerais vous entendre là-dessus.
Je sais que les pourparlers sont en train de se passer présentement.
Answer, I know that discussions are underway right now, but at every step in the process, our focus will be on the health of Canadians, and we'll be making decisions on that basis. Question inaudible in the room? The discussions are ongoing, and we'll see what we can do to protect the health of Canadians. Thank you.
Glenn McGregor, CTV News. Prime Minister, this weekend, your party overwhelmingly endorsed the idea of implementing a universal basic income. Today, you're meeting with the leaders of the NDP and the Green parties, who also both strongly support that idea. You seem less enthusiastic yourself. Can you clarify your position on this? And as you bring in the federal budget, are you going to take the first steps, or is it something you're going to push off to your next mandate?
I know people are eager to find out what's in the budget, but they're going to have to wait until next Monday for us to put forward an ambitious budget for this country that is going to be focused on jobs and growth and building back better, even as we get through these hopefully final stages of the pandemic. I was incredibly pleased to see Liberals gathering virtually from across the country to talk about what building back better looks like, how we can create good jobs and growth, protect the environment, and support the most vulnerable around the country that we've seen have been particularly hard hit by the pandemic. The Liberal Party conventions have been a source of ideas and initiatives that often have made it into platforms and into policy by the Liberal government. I can think of same-sex marriage. I can think of a range of issues that have been brought forward, and we will continue to listen to the grassroots and value their encouragements to continue pursuing various policy options. The things that we've done for the most vulnerable Canadians, whether it's been supporting the middle class and people working hard to join it with things like the Canada Child Benefit, support for seniors by increasing the guaranteed income supplement, reducing taxes on the middle class and raising them the wealthiest 1%, are all things designed to make sure that everyone has a real and fair shot to succeed. And that's exactly what we're going to continue to work on as a party.
Prochaine question.
Hi, David Thornton, CBC News. Prime Minister, you had a lot to say about all the work that your government has been doing during this pandemic to provide benefits for Canadians. But the Bloc and even the NDP is saying that you wouldn't have been so generous had it not been for them pushing you, and that you would have done the minimum to help Canadians. Do you agree with that?
It is the role of political parties to try and make themselves look as good as they can. And as relevant as they can. It is the role of a government to be there to support Canadians. And I made a very straightforward promise at the beginning of this pandemic that we would have people's backs, that we would be there for Canadians as much as it took, for as long as it took to get through this pandemic. Not just because it's the right thing to do morally to be there for each other, but also because it is the smart thing to do to ensure that our economy can come roaring back as quickly as possible after this pandemic. And this is about us as a government being true to the values and the principles that we have led with over the past 5 years. whether it was the very first thing we did was lower taxes for the middle class and raise them on the wealthiest 1%, whether it was the fact that we moved forward with a Canada Child Benefit that lifted hundreds of thousands of kids out of poverty and has made a huge difference in the lives of Canadians. The NDP voted against the Canada Child Benefit. We've continued to move forward on lifting seniors out of poverty. We lifted over 1 million Canadians out of poverty in the first 5 years of our government, at the same time as we created 1 million jobs. The focus we have as a government is on growing the economy and creating opportunities for Canadians, but we know the best way to do that is to make sure that those opportunities are there for everyone. So I'm always happy to see the NDP and the Bloc and the Greens and others supporting the strong measures that we're putting forward. I'm always happy to disagree with the Conservatives when they say that we should have done less for people and more for businesses, because investing in people is something that has demonstrated positive results, not just for Canadians across the country, but for our economy as well, before this pandemic and through this pandemic.
We'll take one last question on the phone. On the floor, please.
Hi, Prime Minister. Chris Reynolds, Canadian Press. Bill C-19, the legislation that would amend the Canada Elections Act to allow a federal election to play out safely and smoothly during a pandemic. This bill has not yet passed second reading in the House of Commons. I'm wondering if you will commit here today to not ask to dissolve Parliament until that legislation is passed, or otherwise trigger an election.
As I've said many times, our priority as a government is being there to support Canadians, being there to give them the supports that they need to get through this. A great example of that is the fall economic statement that put forward significant measures to support Canadian families and workers through this difficult time. Unfortunately, the Conservative Party, amongst others, have been blocking this piece of legislation and preventing that help from getting out to Canadians. That's really disappointing. We need to have a government and a parliament that functions to deliver the supports to Canadians they have, not to have parties play political games. So we're going to stay focused on making sure that Parliament is working for Canadians. And part of that is ensuring that we do move forward on important initiatives like the C-19, the Pandemic Safe Elections Act, which would allow for a federal election to be safer in a pandemic situation. Obviously, nobody wants to have an election right now. Certainly we do not. But I think it is simply responsible to make sure that parties have the choice, for example, to vote against the budget we're putting forward next week and not feel threatened that democracy is so fragile that we can't have an election because they would be putting Canadians at risk. That's why we're disappointed that even though we've brought forward, I think 5 different times, if not more, the Elections Act for debate, it hasn't been able to move forward. We hope that parties are going to put aside their political differences and allow debate and discussion to happen at committee on the Elections Act, because we need to have a parliament that functions. But first and foremost, we need to be delivering for Canadians as we're in this third wave, and we're going to do everything we need to get Canadians the support they have to have while we bring forward a budget, while we move forward on direct supports for Canadians. Depuis les débuts,
from the very start, I made a promise that we would be here for Canadians for as long as it takes and with all the resources required, that we would get through this period. In order for that to happen, we need to deliver within the House of Commons. We have to deliver on our promises within the House of Commons. Promises to Canadians. Unfortunately, the fall economic update has been stalled numerous times by the Conservative Party that is blocking support to Canadians. It is disappointing that they should be playing political games with such important issues for Canadians. Our priority is to make sure that we are here to support Canadians. the other political parties are playing political games from time to time. That is how it happens. That's democracy. But when the time comes to actually help people to ensure that elections that nobody wants, but elections that could be triggered in a democracy, having that be as safe as possible, well, I certainly hope other political parties will support the passage of this bill so that if there were to be elections during a pandemic, these elections would be safer for Canadians.
Merci beaucoup, Monsieur le Premier ministre. C'est tout le temps que vous avez avec nous aujourd'hui.
This is all the time you have today with us. Thank you.
On va maintenant retourner au téléphone pour des questions pour le ministre Leblanc et les docteurs. C'est à vous.
Minister Leblanc, and the public health officers.
From the Globe and Mail. Please go ahead, à vous la parole.
Hi, thank you so much for taking my questions. I'm looking for more information about Moderna. We're seeing repeated delays in shipments from Moderna. I believe we're now looking at the third delay in a row, with provinces being told to expect the shipment that was expected next week to only arrive the week after at the earliest. The Moderna doses that the Prime Minister announced today are actually the ones that were supposed to come last week. So why is this continuing to happen? And is there any clarity on when more certainty will come to Moderna's supply?
So it's Dominic LeBlanc. I'll offer a few comments, and if Dr. Tam or Dr. New want to add something, they obviously can. We have said from the beginning of the vaccine procurement exercise, because of the nature of the global supply chains, because of the nature of the ramp up that these companies are doing around the world, various vaccine manufacturing sites, obviously desperately trying to maximize their capacity and the output, that there would be from time to time some delays that are inevitable in these processes. My colleague Anita Anand has explained some issues around quality assurance that Moderna wanted to ensure were in place in their vaccine manufacturing facilities in Europe. This explained a slight delay in the Moderna shipments. I think she referred to the doses that were arriving in Canada today. I think that were picked up in Europe yesterday. And we're very confident that Moderna will quickly work out these issues around the quality assurance, which is obviously essential for Canadians in terms of receiving the vaccines. So we're not convinced that this is a long-term or significant change that will endure. It's just something that Moderna explained to us was going to be a reality for a few weeks, but we're very much on track to having all the doses we committed to Canadians to having by the end of June, the 44 million, as Madame Anand and others have discussed.
Following up, Marika?
Yeah, I appreciate that response, but the focus on the end of June does not address the fact that each of these doses are needed now and they're continuing to be delayed. I'm wondering what message you've given to provinces on how much buffer time they need to give to their vaccine appointment bookings because of the uncertainty. For example, Ontario said today that the delays are having an impact on the continuity of their vaccine operations. We saw Manitoba cancel appointments last week because of the Moderna delays. We saw Nova Scotia saying that they're working on a 2-week time frame and only allowing appointments to be booked once deliveries have been confirmed because of the uncertainty. So what's your messages to province on how fast they actually can go right now, given this uncertainty?
So our message to provinces and territories, again, has been consistent that we want to work collaboratively with them and share all of the information that we have as a national government in real time with them as vaccine suppliers, inevitably, as I indicated a few minutes ago, inevitably have some adjustments in certain delivery schedules. So General Fortin, the officials of the Public Health Agency of Canada, distribute the best up-to-date information that we have with our partners in provinces and territories. But we share the very real impatience of Canadians to get vaccinated. That's why we've been able to accelerate over 22 million doses of vaccines that were initially expected to arrive in subsequent months. We've been able to accelerate their arrival to an earlier point, and we'll continue to work in that regard relentlessly to do everything we can to get as many doses in Canada as quickly as we can. So that's something that we've committed to do for Canadians, and that's something that we work on with provinces and territories. But we're very confident that provinces and territories have the appropriate systems in place in order to be able to effectively and quickly deliver these doses to Canadians as soon as they arrive in Canada.
Not having other questions on the phone, we'll now go back to the floor. First question.
Dr. Tam, I would like to get your thoughts about holding the Montreal Grand Prix in closed circuit and especially about the quarantines. Would you be open to kind of a bubble so the pilot wouldn't have to respect the quarantine because they can't respect the 14 days quarantine because of the previous event? Where are you at in that reflection? Et Dr. Nou, si vous voulez ajouter quelque chose en français,
and Dr. Nu, if you had anything to add in French, that would be great.
C'est Dr. Nu, peut-être moi je peux commencer. Je suis un peu
Perhaps I can start.
Que Dr. Tam avec,
I'm slightly more involved than Dr. Tam on the
c'est intéressant. Nous autres, on travaille étroitement aussi avec nos collègues aussi à travers le gouvernement fédéral parce que même le dossier pour peut-être les exemptions pour les événements, c'est aussi avec les autres ministères, l'immigration aussi, patrimoine. Donc,
other departments are involved, including Canadian Heritage and industry. Now, with our colleagues at the Public Health Agency, our role is really to analyze the protocols and see
le protocole pour dépistage,
what the screening protocol would be, and what the protocol for quarantines would be. And as the Prime Minister has already noted,
en fin de compte, c'est vraiment il faut
to our
assurer la
minds, at the end of
sécurité et
the
la
day, we
santé des
need to
Canadiens.
make
Ça,
sure
c'est la priorité.
that
Donc,
Canadians are
on
healthy
est
and
toujours en
safe,
mesure de regarder,
and
analyser
we
les
are always
soumissions,
in a position to analyse the
les
submissions
propositions des organisateurs des événements avec la sécurité et santé des Canadiens comme
all
une priorité.
the while focusing on the health and safety of Canadians.
Je peux vous dire que il y a beaucoup de monde aussi, le gouvernement de Québec qui sont en train d'analyser les protocoles, mais je ne suis pas dans une position pour vous dire plus que ça. C'est quelque chose, c'est un enjeu actuel.
Par ailleurs, est-ce que vous pouvez me dire précisément où vous en êtes sur cette idée? J'aimerais savoir un peu une idée d'où vous vous positionnez. Est-ce que vous sentez qu'il y a une ouverture d'une part? D'autre part, qu'est-ce que vous pensez de cette bulle qui permettrait aux gens qui y participent d'éviter la quarantaine?
Je ne sais pas, je comprends bien éviter la quarantaine. C'est sûr que tout le monde qui rentre au Canada normalement, c'est normal pour tous les voyageurs qui arrivent au Canada de passer une quarantaine de 14 jours. Des fois, peut-être on peut donner un exemple. Moi, peut-être donner, comme il dit un avis, un conseil personnel. Des fois, c'est un défi parce que si on analyse un protocole, c'était la même situation, même avec moi, je me souviens des champions de hockey mondial pour les juniors. Donc, on a analysé les protocoles, les propositions des organisateurs à un moment donné. Mais on a dit toujours, hey, on ne sait pas qu'est-ce qui va se passer au futur. C'est quoi la situation? La situation où l'événement va vraiment se passer. C'est la même chose maintenant avec le Formule 1. C'est encore dans quelques mois.
event. It's in a few months from now, and at this point, we're in a very concerning situation with variants of concern, the ICUs in several regions throughout the country that are overwhelmed. So if you look at the situation today, we know that we need to have stringent public health measures in effect. Now is not really the time for me, as far as I'm concerned, to think about other events, but we don't know what may happen in the future. It's a bit difficult to plan something in 2 or 3 months from now because we're really looking at a situation that is happening right
Glenn
now.
McGregor, CTV News. Question for Dr. Tam. We've seen other politicians getting their vaccines on camera, providing a lot of information about it. Your office sent out a black and white photo and won't say even what vaccine you had. Could you give us a little more information about your vaccination today and what you had and under how you qualified for that shot?
Sure. Of course, I'm very happy, like most people who have had a COVID-19 vaccine, that I actually got my shot. What I did was I went online and filled in a registration according to Ottawa Public Health and the Ottawa Hospitals protocols. I wasn't sure, I filled in the questionnaire and I await their respond back to me as to whether this is the time for me. So I did get a response back, and I lined up for my vaccine like everyone else. I didn't know exactly which vaccine I was going to get until I received the electronic email that provided me with information ahead of time as to what all the information every person who receives a vaccine should get. I knew around that time that I was going to get the Pfizer vaccine, and I lined up for it. I was obviously reading about it while I was lining up, and that's what I received.
Thank you. We'll get the next question on the floor.
Abigail Beeman, Global News. I'm just wondering, in light of changing information around vaccination, whether you think that you're doing enough to combat vaccine hesitancy, especially from Canadians who have legitimate questions about that, beyond just telling everybody to get vaccinated.
I'll offer a few comments. Oh, and then Dr. Tam can add. We talked to provinces and territories about this very issue many times. In the First Minister's call that the Prime Minister had last week, he again spoke with other First Ministers around the importance of working together to combat vaccine hesitancy. Also, the importance of directing Canadians to reliable information from different health authorities around vaccination. There is a significant amount of disinformation circulating. The best way to combat that is to empower Canadians to have access to reliable scientific information from independent scientific authorities and public health professionals. That's the best way to reassure Canadians that the vaccines are safe and effective. And we'll continue to work with provinces and territories and the medical community across the country to do whatever we can to enhance public confidence in something that we believe is entirely safe and very effective. But Dr. Tam and Dr. New can probably add more.
Thank you for this question. It's an extremely important aspect of rolling out the vaccine programs. As you've seen, there's many different surveys looking at whether people intend to be to get the vaccine, and I think the latest survey suggests that like 80% of Canadians plan to get the vaccine, but many of them still have questions, particularly about safety, and those have to be addressed straight on. And so, as Minister LeBlanc has said, enabling healthcare providers to provide those specific answers is very important. So, what we're trying to do is provide the tools that they need, training, webinars, including any new developments, such as you've just seen in the rare cases of clotting with low blood platelets is something that we try to get out to health professionals and different organizations as well that may be communicating with people in Canada about getting the vaccine. We have been supporting some funding to enable trusted community level organizations to try and get information across to their communities. I gave a couple of examples, including churches, church leaders, Black Canadians taking their place in terms of helping out and getting the information to their communities because they are more trusted by the communities who've experienced health inequities. And so getting to the people who communities and individual trusts is very much part of that strategy. Indigenous leadership. I think we need to highlight just how important that has been in getting so many First Nations communities and the territories having such a successful approach in getting people vaccinated. I do think that there is more to be done, whether it's through social media and other channels, to reach the younger age groups because soon they will be in that space. Working with workplaces, we've heard workplaces also working with local level and provincial level programs to help get their workers vaccinated, offering their workplaces so that there's increased access. So access is really important. It's not just a matter of people having questions about the vaccine, but can you get the vaccine to them as efficiently as possible? So all of those different approaches need to all be done depending on your local situation.
We'll take one last question before ending this presser today.
Hi, Dr. Tam. This is Chris Reynolds with Canadian Press. Since we have limited time, a double-barreled question for you. First of all, I'm wondering, with the record number of patients in ICUs, but death toll that's well below the record numbers, is that because of the vaccines? And secondly, with the clotting events largely happening to women, why isn't advice around AstraZeneca gender-specific? Thanks.
Yes, on the first question. Now I've almost forgotten it. So let's start with the last question. So I think Health Canada has requested through their terms and conditions for authorizations specific information from AstraZeneca for the Canadian context, which means they would have also asked for the age and sex breakdown of cases so that we can analyze them. But these are rare events, so it's very difficult when the case numbers are quite unstable. The rates, when you have a very rare event over a large denominator, to try and get a handle of that. But in the end, what is actually really important is to look at the rates of severe outcomes in different age groups. This might change depending on your jurisdiction, but also with the rising cases and increased numbers of severe outcomes in younger populations, the analysis on the impact of COVID-19 also has to be taken into account when you look at that benefit and risk analysis. So the data is moving both in terms of the disaggregate data for the rare adverse event and on the COVID-related impacts. So that analysis will be undertaken by the regulator, but also by the National Advisory Committee on Immunization. And provinces also do that, looking at their own specific context, as well as their vaccine supply. And that will be sort of re-articulated in the coming days. So we look forward to that kind of data. At the last round, there wasn't enough information to essentially distinguish whether there's any sex difference in terms of the risk. But we'll await and see what the next analysis shows. In terms of the, I think it was on the rising rates of severe outcomes. So deaths, was an incredible sort of heartening, I think, result to see the rates decreasing in those over 80 as they were the first to become offered the vaccine, and the rates of long-term care facility outbreaks go down quite dramatically, together with a number of cases in those populations. At the same time, of course, there's been public health measures, infection control measures being applied, but we do believe the vaccine has had an impact and has been effective in reducing severe outcomes in those who were initially prioritized. So what we'll be watching carefully on is, well, what happens in the next age group, for example, and those other priority groups that receive the vaccine. There's some very good data suggesting that health workers that have been initially vaccinated, first of all, with the one dose, has had really good vaccine effectiveness. And so all the vaccines that we have protect against severe outcomes really well. But what I would say is that death or mortality is still a lagging indicator, as I've said in my opening remarks. So when we see ICU cases going up, as well as hospitalizations, I do not know what is going to happen in another number of days to do in terms of the deaths and who are implicated in that very severe outcome. Still, I think most deaths still occur in the older populations, but we will see.
Merci beaucoup, Dr. Tam. C'est ce qui m'a fait la conférence de presse aujourd'hui.
Thank you, Dr. Tam. This ends our press conference today.